Hello everyone, this is Dr. Bindupriya, consultant urogynecologist from Hyderabad. Today we would be learning about urinary tract infection in females. Why is it important? How do we diagnose? And how is it treated? Urinary tract infection is nothing but infection of the urinary tract, that is ranging from kidneys, ureters, the urinary bladder and urethra. Most commonly, infection of the bladder is what we see in our clinical practice. It is also called as cystitis. The organisms that lead to urinary tract infection, they are usually the gut bacteria. In females, there is a short traveling distance from the gut to the urinary passage, and this is like one of the reason why females are more affected when compared to males with urinary tract infection. Once the bacteria, they come and colonize the urinary tract and then they proliferate, and that is how we end up having a active urinary tract infection. What are the symptoms of urinary tract infection? Mostly to diagnose, in short, urinary tract infection is also called as UTI. Mostly UTI is a clinical diagnosis, meaning depending on the patient's symptoms like urinary urgency, then urinary frequency, and there is some amount of discomfort in her lower tummy, and sometimes there is foul smelling urine, there is frothiness in the urine, and sometimes there is a change in the urine, especially passing blood. These are all the symptoms of urinary tract infection. And to corroborate this, sometimes we have to rely on urine examination, and also to identify like what kind of bacteria is causing this infection. Sometimes we may have to go for urine culture. And once a diagnosis of urinary tract infection is made, it is very important that you see your doctor and never go for over the counter medications. The sole reason being because we have to identify what antibiotic is suitable, and then the correct duration and the correct dose, everything matters, so that the bacteria gets completely eliminated, and then there is no risk for repeated or recurrent urinary tract infection. And it is also very essential for us to maintain few good bladder habits like drinking adequate water, peeing at appropriate time, not holding your bladder for a very long time, and maintaining sexual hygiene, that is emptying your bladder before and after sexual intercourse, and also maintaining a proper perineal hygiene. These are all few important tips to make sure that you don't end up having a urinary tract infection. I would say stay informed, stay healthy.